Mm-hmm.
Tell me when you're ready. Okay. Knock, knock. Hey, Mr. Smith, my name is Shelley. I'm going to be your nurse today, and I'm going to do some trach care. Can you tell me your name and date of birth? Okay. We did your suctioning already, so we're going to do your trach care afterwards. I'm going to pick your bed up some. Without catching your arm in it. I'm going to put my table up close to me. Do you have any questions before we get started? Okay, well, I'm going to lay your head back to make it easier for us. Okay. Open the saline. It's still good. Again, I'm going to put my table here so I can reach it better. I'm going to open this away from me. I've got my table cleared off because it's going to make it a lot easier to do with a table that's cleared off. Okay. Side down. I'm going to get all of my stuff out. I'm going to spin mine a little bit so that the bigger one is there. Now I'm going to contaminate my non-dominant hand. I'm going to come around my sterile field, whip it, and I'm going to pour my 3 basins full of the normal saline. Come back around. This hand is contaminated. I'm going to take out the inner cannula. And I want to be sure not to touch the inside of that cannula to anything. So I've got it. I'm going to put it in my first basin. All I can touch is the white part with my contaminated hand. With my sterile hand, I'm going to take my cleaning. I'm going to clean the outside of it. I'm going to clean the inside of it. And I want to be sure that I'm not cleaning over my sterile field. You want to clean over here. You don't reach over your sterile field. I'm going to clean, 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 clean. I'm just going to leave that in there. If you need to take the pipe cleaners, you can. Clean down in it. Just leave it in there. You don't want to lay them back on your sterile field if they're dirty. Then I'm going to dip this in my rinsing to rinse it. I can tap, 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 tap it, or I could dab the excess droplets of the normal saline onto this, okay? Then I'm going to take it, still, I have to only touch the white part. This is the end of the sterile process, so I'm going to move this over. And I have to put that in the hole without hitting the outside. I'm going to put it in. Then I am going to click it to lock it. Okay, so that's the end of the sterile process. Now I'm going to take off the gauze from under the patient's neck for the faceplate of it. Well, it's easier said than done. There we go. want to be sure not to pull on that too much. And I'm going to throw this one away. Pick up 3 of my Q-tips. I'm going to dip it in my 3rd basin. And I'm going to clean around and under it with 1 swap. Again, you got to get right up close to the insertion site. 2 swaps. And we'll do a 3rd swap. These do not lay in these mannequins' necks as well as they should. I'm going to take my gauze if I need to and clean around my faceplate. Take my last one and clean it up in here, or you could even clean around the patient's neck if it's got a lot of secretions around it. Then I want to untie one of these. Again, hold on to it because that string is all that is holding it into the patient's airway. And you want to put the gauze under the neck plate. Okay. I want it to be as flat as possible. Bring the string around. We're going to tie our ties. Okay, to do a loop knot, let's see if we can do it the best way for a video. You're just going to tie half a bunny ear, so it's like a bow but not pulled all the way through. Get it tight. Come around the patient's neck. Undo the other one. Get rid of this one. Pull it right there. It needs to be a little bit tighter. You do need to practice doing this with gloves on. It does make it a little harder. As you can see, my gloves are big and it's making it harder for me. Okay, so it's on. Put their oxygen back on them. Are you doing all right, sir? Okay, we're going to pick his end of the bed up. Going to take my gloves off. I'm going to clean up my mess. I'm going to wash my hands. I'm going to raise this side rail. Put his call light in reach. Pull the curtain back. Put his bed in low position. And put him in a position of comfort. A little bit there. There we go. And then I would go document the procedure and how he tolerated it. And that's it.